So I did a video a while back on how to reconstitute powdered medication, and one of my subscribers asked me, nowadays I'm experiencing difficulty in loading the sterile water into the vial. Suggest me some techniques. So if you want a detailed version, you can always click on the link below to watch the full version. But in regards to suggestions, so we all have to start somewhere. So I remember I was in nursing school doing my clinical rotations, and one of my preceptors pulled me aside. We're in the room and she sat down and she said, here's a 3cc syringe. She's like, grab it and I want you to connect it to the luer lock of the patient's IV. And I thought to myself, that is so easy. Like, why is she asking me this? It's so like common sense. So I went to the bedside, I had my gloves on, did my hand hygiene. I grabbed an alcohol prep, I cleaned it, and then I tried to attach it and I couldn't attach it. And I thought to myself, oh my goodness, like, why can't I get it? And she goes, come on. She's like, keep practicing. So that moment right there, it really stuck with me because I knew I wanted to be a nurse, but I didn't have the skill set to do that quite yet. So I had to learn the skills. So where I'm going with this is you have to practice, and get comfortable with it prior to being able to move forward. So this is why we have clinical rotations. So then that way you can feel more comfortable with your skill set. So what I suggest you do is you grab a 3cc syringe and just get comfortable with moving the syringe up and down. For me, it looks different because I'm a lefty, and so because I'm a lefty, I'm using my dominant hand to move it up and down, up and down. So when you're actually going to withdraw the diluent from the vial, you want to look at the center of the top of the cap, and you see that the center as like a dart, and that's where you're gonna puncture the needle into it. So if you actually grab a banana and you draw a little with the permanent marker circles around there, and you practice puncturing it in and out with the needle, you'll get more comfortable with making that puncture into the banana. And the reason why I say that is because when you are drawing blood, starting an IV, giving an IM injection versus a subcutaneous injection, it's all different techniques that we have to learn. So I think using a banana, you'll be able to better know how to puncture the actual vial into the center, and you'll get more comfortable with your technique. So when I do put it in to the center cap, I will puncture the center, the bullseye. I put it in and then I bring it upside down. I will lower the actual needle all the way to the bottom. And sometimes some manufacturers will have a little open slit where you can visually see the fluid coming, and so that's when you know you can lower the needle even further and then withdraw the medication that you need to withdraw from the vial. So that's one technique as well. These are some tips that I suggest that you start off with to better prepare you for your clinical rotation. Alrighty, I'll catch you on the next one. Take care.